Go for it, guys. Sorry. Am I live, guys?
You will be in the video.
Hi, my name is Dr. Tariq Kapasi. Welcome to the fourth public-facing webinar hosted by Willows Health in collaboration with the Leicester Primary Care Networks. We've had a hugely successful webinar series so far, attracting over 6,000 people nationally. There has been a demand for another webinar to help our fellow residents of Leicester have an up-to-date idea of where we are with coronavirus. Today we've got Professor Ivan Brown hopefully joining us. I'm told that we've got a few technical problems. He's the Director of Public Health in Leicester City, and he's going to help us tackle the questions which are on everybody's lips. We also have Dr. Aruna Garcia, who is a practicing GP, talking about what changes there are to local NHS services and what to expect over the coming months. The other big issue we're going to be talking about today is flu. And we're going to talk about why this year is going to be the biggest flu vaccination campaign in history. Professor Mayur Lakhani, who is a GP and chair of West Leicestershire CCG, has joined us today to speak about this really important topic. Finally, we have Sue Welford, who's the Principal Education Officer from the Leicester City Council, who's going to talk about the hard work schools are doing to reduce the risk of coronavirus to children. So you can find links to all of our previous webinars on the Willows Health YouTube channel. We've also got a number of multilingual videos on the previous webinars and on coronavirus. Some of that information may not completely be up to date because the public health guidance is rapidly changing, as anybody who tuned in to the Downing Street briefing at 5 p.m. will know. This is also a live event, so we really want our attendees to ask the questions that matter. And if you do have any questions that matter, then put them onto the question chat and we will try our very best to answer them. So I can see Professor Brown has joined us today, but I am going to go to Professor Mayur Lakhani initially to talk about the biggest flu vaccination in history. So this year's flu vaccination is very different, and Prof Lakhani is going to tell us why that is. So Professor Lakhani, tell us why this is the biggest flu vaccination in history.
Well, good evening, Tariq, and good evening to everyone on this call today. I'm very pleased to have this opportunity to talk to you about flu. I appreciate the worrying time for people of Leicester and Leicestershire. As a working GP, I see that every day and I detect that sense of anxiety. Our worry this year is that we could have the double whammy of a flu epidemic and a coronavirus outbreak. Both of those together would be very serious. We know that flu tends to affect the same people that are vulnerable to coronavirus. So this year, more than ever before, we need to make sure that people who are in the at-risk group get the flu vaccination. You know, I always like to think prevention is better than cure. So for one virus, the flu virus, we have a flu vaccine that's proven safe and effective. So across the United Kingdom, we expect to give 30 million doses of the flu vaccination during 2021. So this winter is really important. We need to get it right. And you know, it saddens me as a working GP that I see sadly some people get pneumonia, get complications for children and older people. Sometimes they're going to hospital. I've seen some people die because of flu-related complications, and that's unnecessary. Therefore, we need to promote the flu vaccination. And this year, right now, as the campaign starts, I want to promote and give that key message to you today as to why this year is different from any other year.
Thank you, Professor Lakhani. So I think, you know, you've hit the nail on the head. We see our patients die from flu every year. And we know that there are lots of people who die across the world and in the country. And a lot of people think that flu isn't serious and they don't need the vaccine. How can you sort of manage that particular myth that people might have, Professor Lakhani?
So I think that's our biggest danger. You know, I think we're too complacent. We treat flu too casually. We think it's like a cold, but proper flu is serious and life-threatening. I know I've had flu in 1993, a year that I didn't have a flu jab because at that stage I wasn't in the eligible group, and I felt like I was going to die. So flu is not something to be trifled with. I think our biggest enemy is complacency. 28,000 people die from flu every year in England. And I have to say, I'm sorry to say that the uptake rates in our area are less than 50% for people under the age of 65. We need to do much better. I mean, for example, would you not let your child have an important flu vaccination? Would you not have travel vaccination? So why do we take a risk with flu? So this year, our ambition is very, very high. So if you get a letter from your doctor or a letter from school about your child, please agree to it, talk about it, think about it, ask questions. We know you have questions, we're happy to answer them, but I'd really like you to do that for us this time to protect the people of Leicester and Leicestershire, especially because the groups who get flu are the same groups who are vulnerable to COVID, and we don't want that scenario at all.
Thanks, Professor Lakhani. And we just need to myth bust, I think, some of the commonly held conceptions people have about the flu vaccination. And I myself are quite alarmed by the fact that only 50% of people uptake the flu vaccine under the age of 65. And so I think it's really important to try and understand why that is. There's a commonly held belief that the flu vaccination itself can cause the flu. Can it cause the flu, Professor Lakhani?
So no, it cannot cause the flu, and this is a common misconception. So the flu vaccine does not contain a live virus that can cause the flu. So this is a dead virus, and that's the commonest myth. So we need to bust these myths. And just to go back to the figures, you'd be interested to know that for pregnant women for whom this is highly recommended, this vaccine, only 45% of people in our area take the flu vaccine up. For children aged 2 and 3, only 50%. And children can get flu quite seriously. But the important thing about children getting flu, and this is often less well known, is they can spread the flu to their vulnerable parents or grandparents, particularly in extended families. And for under 65s in the high risk groups, diabetes, liver disease, only 40% have this. So this year we need to change that. Our ambition is 75%. So the vaccine is safe. It doesn't give you flu. You need to have one every year. Side effects are minimal. Most of you will know somebody who's had a flu jab and know that, obviously it can be sore when you have it. You may feel slightly unwell for a few hours, but rare side effects are very rare. But can I say we want you to make an informed decision. We want you to find out more about the vaccine, ask questions. We want to give you the evidence to support you to make the decision. But this year, more than ever, do you have the flu vaccination?
Thank you, Prof. So we've got a few questions coming in, and I'm noting them. We will answer them very shortly. Now, Sam has actually asked one particular question which is relevant to the flu, and he's asking, the rates of people who die with flu each year are higher than those who die of coronavirus. Are they, Professor Lakhani? Is that true?
I would need to look into that. I don't have that exact information to hand. I mean, obviously, coronavirus is I think it's a deadlier virus. There's no question about it because it causes this massive problem with your lungs and causes all kinds of chemical reactions in your body. But the risk groups for flu and coronavirus are the same. I don't think we know enough yet because we haven't had the flu season in this country yet. But can I say, I don't think we should be complacent. I think we need to guard against flu and we need to guard against coronavirus. Hopefully we will have a vaccine against coronavirus. I know we'll come on to that later on. So you'll need vaccination against both. Again, our biggest danger is complacency. Now, you know, I often worry and know that people who need the flu vaccine the most don't get it for whatever reason. This year we want to make it as easy as possible for you to get it. So I don't think there should be any impression that flu is a mild illness and we can deal with it in the normal ways. Prevention is better than cure.
Thank you, Professor Lakhani. So I think the key thing is that 28,000 people die from the flu in the United Kingdom. We've got 650,000 people dying every year from the flu. And yes, the numbers from COVID are significant, but we do have a vaccine to try and help mitigate the flu. We may not yet have the COVID vaccine, but let's talk more specifically about the vaccine itself. There is a concern that the vaccine doesn't work. Professor Lakhani, can we just allay that myth that the vaccine doesn't work?
Okay. So can I say that's a very fair question. The reason it's difficult is that the strain of the virus that causes flu every year changes. There are what's called mutations and different types of viruses circulating. So the World Health Organization, they have a big committee that decides each year what is the most likely strain of flu, whether it's A, B, or C. A is very deadly. So from this, they can come up with the most likely virus that's likely to cause influenza. And from that, they develop the influenza vaccine. So it's not always a perfect match. And I want to be honest and transparent with you about that. I cannot say that it's going to stop 100% of infections. Can I say there's very few treatments or vaccinations that can do it? But it's more likely than not to do it. In a good year, it can be up to 80% successful. In another year, it may be less successful. But of course, it doesn't stop you getting a cold or to catch another virus. So I think to make your decision, this is the best available vaccine. I'll certainly be having it. I'm usually the first one to have it. I think our vaccines are coming next week. So we're talking at a really good time here. And the benefits, in my view, exceed the risks, and it'll give you much more protection than anything else you can do against the flu infection.
Thank you, Professor Lakhani. There are a few of the questions that we may return to you later with, particularly if our audience has some questions relating to the flu. We're going to move on to the discussion surrounding coronavirus, but just before we do that, we're just going to share a short 2-minute public health video in Gujarati relating to the flu vaccine. And after that, we'll move on to the coronavirus related questions to Professor Brown.
જ્યારે આપણને ઉધરસ કે શરદી થાય ત્યારે આપણને લાગે છે કે ફ્લૂ થઈ ગયો છે, પરંતુ ફ્લૂમાં આપણી તબિયત વધારે બગડી જાય છે. તાવ, સાંકળો અને અશક્તિ પણ થાય છે. ક્યારેક થોડાક સમય માટે ખાંચલાવસું પણ થવું પડે છે. આપણા લોકોને ફ્લૂ જલ્દી પકડાઈ જાય છે. એના કારણે ફેફસામાં નિમોનિયા અને બ્રોન્કાઇટિસ પણ થઈ શકે છે. તબિયત વધારે બગડી જાય તો હોસ્પિટલમાં દાખલ થવું પડે છે અને ક્યારેક મૃત્યુ પણ કારણ બની શકે છે. ફ્લૂ ન ફેલાય તેના માટે તમે સાદા કાર્ય કરી શકો છો, છીંક કે ઉધરસ આવે ત્યારે રૂમાલ કે ટીશ્યુ મોઢા પર ઢાંકી દેવાનું. હાથ વારંવાર ધોવાના અને હાથ ધોવાની વ્યવસ્થા ન હોય તો હેન્ડ સેનિટાઈઝર પણ વપરાય. ફ્લૂથી બચવા માટે અને ફ્લૂનો ફેલાવો અટકાવવા માટે સર્વશ્રેષ્ઠ ઉપાય એ છે કે તમે ફ્લૂ વેક્સિનેશન લઈ લો. ફ્લૂની સિઝન ઓક્ટોબરથી શરૂ થઈ છે, તો તમારા માટે ફ્લૂ વેક્સિનેશન ટાઈમ પહેલા લેવાનું વધારે મહત્વનું છે. જો તમે 65 વર્ષની ઉંમરના કે વધારે હો, કે તમને ડાયાબિટીસ કે આસ્મા છે, અથવા તમે પ્રેગ્નન્ટ છો, તમે શિલ્ડિંગ કરતા હોય કે તમારા ઘરમાં કોઈ શિલ્ડિંગ કરતું હોય અને તમે એની ચાકરી કરતા હોય, તમે હેલ્થ એન્ડ સોશિયલ કેરમાં કામ કરતા હો, તો તમને સર્જીવાળા ફોન કરશે તમારા માટે ફ્લૂ વેક્સિનેશનની અપોઇન્ટમેન્ટ બુક કરવા માટે. બાળકો જે 2 થી 3 વર્ષથી 11 વર્ષની ઉંમરના હોય તેને પણ ફ્લૂ વેક્સિનેશન મળી શકશે. એ લોકોને સ્કૂલમાં આપશે અથવા તમે સર્જરીમાં પણ લઈ આવી શકશો. જે લોકોને કોરોના વાયરસ થવાના ચાન્સીસ વધારે છે કે ડર છે કે એ લોકોને થશે કારણ કે એ લોકોને કંઈક જૂની બીમારી છે, એ લોકોને ફ્લૂથી સિરિયસ કોમ્પ્લિકેશન્સ થવાના ચાન્સીસ પણ વધારે છે. તમને વિનંતી છે કે તમે ફ્લૂ વેક્સિનેશન લેજો આ વર્ષે અને એકબીજાનું ધ્યાન રાખજો અને ફ્લૂ ફેલાવાનું અટકાવજો.
So thank you very much to Reema for providing that Gujarati public health education video in Gujarati. I think it's really important that everybody really buckles up and has their flu vaccine this year. I think that's enough of flu just now. I'm going to move on to our man, Professor Ivan Brown, who I thought was going to have a few weeks of respite, but listening to the news and listening to the uptick of cases, it doesn't look like you're going to be resting anytime soon, Professor Brown. Can you tell us about the coronavirus-related updates locally and nationally?
Yeah, absolutely. And thank you for the opportunity to come on this evening. So yes, we know that as a city, we have been working really hard to suppress the coronavirus. And I have to say that as a city, we have responded incredibly well to that. So if we think about where we were at the sort of end of June, as you know, we had amongst the highest rates of coronavirus in the country. Well, not amongst, the highest by some substantial way. And as a city, we have worked and worked and worked at this. And where we were in terms of last week, we had pushed down that figure from sort of the 135 cases per 100,000 that we had at the peak of this second one, and we were down to 25 per 100,000. So a real suppression of the virus, and we're pushing towards our goal. I think we said that we wanted to be at 20 by the end of September. So we were in great shape. And then nationally, over the weekend, and I was watching the numbers really carefully, over the weekend, you just saw this rising tide of cases. And Leicester also got swept up in that. So we sort of moved from that position of 25 and going down. And I was just watching our figures move up to, 35, 39. And I think of today, we're about 41. So what's going on? What was happening? Well, if we track back to that, we don't know what it was specifically. We do know that there was a bank holiday prior to that, given the 2 weeks before that. Could it be that people were relaxing more? Could it be that people just felt a little bit more complacent? And whilst it hasn't been the sharp spike that we've seen in places across the country, where some have gone from very low figures to extremely high figures, we have seen something. And looking at the data, it's not located with particular businesses. It's not even located in the northeast of the city. It has just been a general uptick in terms of numbers. So as I said, my message remains the same. We have to be vigilant about this. We have to realize this is not going to go away. And I did say previously, as a city, we're at a tipping point. But what I'd actually say is, as a country, we're actually at a tipping point at the moment.
Thanks, Professor Brown. That's a really important reminder. And I think we've done so much as a city to actually revert back to some degree of normality. Now, we've got a question from Sally, who's asking, what is the current R number for Leicester City?
Okay, thank you, Sally. I think it'd be really interesting if you, I don't know if people have noticed, but there was a time when the R number was it. Everybody wanted to know the R number. And whilst that sort of reproductive number is incredibly important, when you're looking at it from a national, the bigger the numbers that you're dealing with, the more reliable the R number becomes. Unfortunately, when you start going down to regional levels and local levels, the R number becomes less meaningful. And that's one of the reasons why R numbers at sub-regional levels are not really calculated. And I'll give you an example of why, because remember, this is about the reproductive rate of the virus. So if you're in a situation where one day you had one case of coronavirus in your area, and the next day you had 2 cases of coronavirus in your area, your R value doubles. But equally, if you had 1,000 cases of coronavirus in your area, and then it increased by 500, it only halves. So I'm just trying to show that it's really dependent on populations, and it's really dependent on knowing what the prevalence is. The experts who do this do sampling across the country, and they sample in different areas, and that's how they judge their R value. So without comprehensive sampling in Leicester, the R value would be very difficult to calculate. But what we do know intuitively is that we feel that we are hovering around that kind of R1 figure, just above R1. So what we haven't seen is exponential growth, and that's what we're trying to stop from happening. But if we don't take the precautions, if we don't follow the guidance, it's very easy for that number to get away from you.
Thanks, Professor Brown. That's really useful about the R number, because we hear it on the news all the time. And there is a question again on the chat talking about testing, and we've got lots of tests being done. Are the increase in cases associated with the increased testing we are doing, or can it be attributed to other factors?
Okay, so if we look nationally, and I think this is a line that governments are using quite a lot, which is the increase in numbers that we're seeing are as a result of increased testing. I think there is some degree of truth in that. However, we also know that cases that are circulating around, we've had the positivity in certain areas indicating actually no, we are actually finding more. So I think it's part of the story. Would I say it's the whole story? No, I wouldn't. I think that what we are seeing is cases of community transmission. We are finding them. We are testing more. I think Leicester are quite disciplined around their testing, actually. I was looking at some data just today to see about the number of people that present, the proportion of people that test who are actually coming with symptoms. And we are amongst the higher areas that come with symptoms, not just out of curiosity. We actually come to find out whether we are positive or whether we're not. And that's the right way to do it. I'm sure there will be other queries about tests and the current situation about the availability of tests, but I'll let that question come up when it's ready.
That's great. Thank you, Professor Brown. One of the things that I've looked at is hospital admissions and complications from coronavirus. So as far as I'm aware, there is an increase in cases, but that's not being correlated with an increase in hospital admissions or deaths. Can you shed some more light on this as to why this could be, and whether we could expect an increase in hospital admissions over the coming weeks?
Dr. Kapasi, that's a great question. I don't know who asked it, but that's a great question, because that's been one of the ones that has challenged me. So my initial reaction to the increased number of community cases that we saw in the city was, oh my goodness, we're really going to have to worry about our hospitals, we're going to have to worry about deaths, and start to monitor it in that way. But interestingly, we didn't see this community transmission. And remember, we were the first on this. We were the first ones that kind of spotted this. Very different from that situation that we saw in March. This time around, there didn't appear to be a correlation between the number of cases we're seeing in the community and the number of hospital admissions. So as we started to dig into this more, there are some patterns that we started to see. And now they're very well known and they're very well rehearsed. But obviously, being the first, we were trying to work this out as we were going along. And one of the things we certainly saw in the earlies was this was very much being, the case that we were seeing were young people. We were very much seeing around that, the median age that we were seeing in the city was around 34, which again was very different from what we saw in March. Now, this is the thing about COVID, is it's quite differential in terms of who it targets. It's not to say that it will not harm people that are younger, and we know that we do get those cases that are very sad and very unfortunate and can even lead to death in young people. But it compared to that older cohort, the fatality rate is completely different. So what we were seeing were people that had it, that they were actually getting through it, but were not calling on health services. But the worry for us, of course, is that as it circulates amongst that younger community, there is a risk that that younger community can inadvertently pass it on to older communities. And that may take some time in terms of how it goes. But that's the concern. That's the thing that we're really trying to make sure that we see. To date, a lot of the work that has been done in terms of shielding, in terms of the way that people look after their senior members within their household to shield them, has clearly been, effective. But we can't be complacent around that. And with winter coming, as Professor Lakhani had said, when you start getting complications, when you start putting flu into this mix, when you start putting people being more in their house than they were normally. Young people are out and about during the summer months, but they kind of lock into their house during the winter months. That's when we start to get really concerned about what that mix may mean. And that's why we are pressing really hard about trying to get this under control as quickly as we can.
Thank you, Professor Brown. And I suspect this is even more relevant in Leicester because we have data which shows we have groups who are at higher risk. We have groups living in multi-generational families. There's increased risk of chronic health. And so it's really important that we follow the public health advice. And what are the public health advice guidelines now, Professor Brown? They seem to be changing from one week to another. I can just about keep an idea as to what's going on at one moment in time. So what's happening now? What's the guidelines which have been released today? I'm sure there was a briefing at 5 o'clock today. Right.
So interestingly, I seem to find out via the BBC News and Twitter like everybody else. And I remember last night that, when my phone pinged, in fact, I think it was my wife who said to me, oh, there's a guidance change. And, I was finding out at the same time. So we're going to get the details of the guidance. But the big thing that I think is that this idea of making sure that we don't have more than 6 people socially mixing, but indoors or outdoors. Now, that brings us, I've said for the city, what that fundamentally does is it brings the rest of the country more into line with the situation that we've been experiencing for some time. So it seems like the country is moving to the city perspective as opposed to, we were hoping that we would be moving more to the country's position. So it really is to try and limit those groups. So sometimes you will see on the park, because of the previous guidance, you had groups of up to 30, all socially distant, but they could be together, and the police couldn't do anything because actually you could be into groups of up to 30. Now that is being broken down to 6. that's inside or outside. So it's really, we have moved very much from the idea of sort of economic restriction measures to social restriction measures. But for Leicester, we are still under the guidance that says that you cannot have household mixing. So we are a step beyond that. So we are still at the point where two households, and when I say households, I mean houses. So if your auntie lives next door to you, she is not your household. It's the house that you live in. Those houses cannot mix either inside or outside. So that's the difference with the Leicester picture. It's very similar. Well, not similar. It's exactly the same as the picture that you're seeing in the northwest. That also applies to Leicester. I think it will be interesting to see how this next restriction goes, to see whether that in itself gets rolled out nationally. But we are in that position at the moment.
Thanks, Professor Brown. So at your prompt, we've had some questions relating to the testing capacity in Leicester. What is the testing capacity in Leicester at the moment? And are the centres full? Is there capacity to do the tests at this moment in time? Right, so I think that everybody has seen the various stories. You live in Leicester and you're asked to go to Glasgow or something. We've seen people having to really struggle to get a test. So obviously we've been trying to investigate what has been going on here in the national system. And what it appears to happen is that it is the laboratory capacity, the Lighthouse labs and all of the other labs are absolutely swamped at the moment in terms of processing tests. And that has led to a backlog and a restriction around that. The driver for that appears to be lots of people using, so the asymptomatic testing, people who haven't got symptoms turning up just to check and maybe doing it on a weekly or a daily basis. So there's been a real push from central government to say, look, you absolutely should go and get tested if you've got symptoms, but if you haven't got symptoms, please don't go and routinely almost use the testing capacity just as a screen. So that's what we've got to step away from in order to try and make sure that we've got capacity for those that have got symptoms. That's what we're working on. In terms of the situation with the city, oops, right. I think we just had a bandwidth issue there.
I think we did.
So what we got to was in terms of the situation with the city, Professor Brown, so I'll let you continue.
Thank you. So where we have got to is that we have got some capacity in the city. Why is this cutting out on me?
It's fine, Ivan, keep going.
Okay, we have testing capacity within the city. We are being prioritised on the basis that we are still one of those areas of interest. I think we're probably 18th or 19th on the list. Yesterday was a huge problem because we didn't have that, but I've got an assurance today that places like Victoria Park, site, etc., that there will be tests made available for the city. So we're working to make sure that we've got that.
So it seems like the powers that be are working hard to resume testing capacity, but also it's clear that there's a responsibility amongst the residents of Leicester to not test when they don't have symptoms. And I think that's really important. I think all of us have a responsibility to use healthcare facilities only when we absolutely need them. But it does lead to other questions, Professor Brown, because coronavirus is a virus, the flu virus is a virus. There are lots of other viruses circulating as we go into the colder months. And particularly in children, they can present with really similar symptoms. And there was a question on the chat about how do we differentiate these sort of symptoms? Because we're going to have our kids come back from school with runny noses, coughs and a fever. What do we do in that circumstance?
Yeah, and I think that's why we were all rushing to try and get those figures down as low as we could before winter, because that degree of complexity, Dr. Kapasi, is exactly what we're worried about. And I think that what we're asking parents to do, what we're trying to do ourselves, is to use the information that you have available. If you've got a child that's got the cough and the temperature, get them tested. I mean, we're not saying don't get them tested. You've got to get them tested. It might be something else, but it has to be done. But all we're saying is, don't do it on the basis of, I just need to check. If there are symptoms, that's what testing is for, to help us with that.
Thanks, Professor Brown. So I think we just need to be really clear in terms of what parents should do if their children become unwell, because this is a very, very likely possibility and probably a certainty given the frequency of childhood infections children have just normally because of all the other viruses circulating. So let's say I was to pick up my child from nursery. She's got a runny nose, she's feeling a bit feverish. In normal circumstances, I'd let nursery know she's not particularly well. Give her some paracetamol perhaps. Seek medical advice if actually I'm concerned. So in this circumstance, we're suggesting we try and arrange a coronavirus test. We then inform the school so that they're aware. So presumably, ideally, the tests would happen quite quickly, so you get the results back quickly, so the school can do whatever they need to put in the interventions they do. Would that be about right, Professor Brown?
Yes, so that's a classic example of a parent doing the right thing. So they're over that age, you've got concerns, you say, hold on a minute, let's hold, let's check. Back in the days when we had everything going right, so I'm hoping we're going to get there, that then says 24 hours later, I get my test result back, child is clear, let them go back. I was a bit worried about it, but it seems that it's okay. That's exactly what I know that Sue would want to happen, rather than saying, well, we'll just ship them off to school and just do it that way. So it is that there is a role, there's a really key role for parents and carers in this scenario. Don't let guidance dull your common sense, as it were. Just doing the right things, doing it in a way that you think, how can that protect my child, protect my family, protect the school, and actually also protect the NHS, because very often they all end up being the same thing, the same action.
Thanks, Professor Brown. So I just want to be really clear on this. So if you've got a child who comes back from nursery or school and they're unwell, you try and book a test, but if you're concerned, then you need to seek medical attention. And I'm going to come to Dr. Garcia, who is a frontline clinician in Leicester City. So I'm the parent and I've got a child, I'm concerned about my child. I've booked a coronavirus test. What do I do? Who do I call with the concern I have about my child?
Thanks, Dr. Kapasi. So I think we're all parents. I think we've hopefully, you probably, if they're older than one, we'll have been in flu season before, and we've had children with runny noses and coughs and colds. And in the same way that you would look at your child and think, am I worried about them? Those markers are the same in this particular scenario, apart from the fact that we're thinking we might do the test if they've got new sort of flu-like symptoms. If you're worried about your child, at the end of the day, just call the GP and phone them up like you would normally and say, I'm worried. What do I do? There's also information on your website or your practice website, and you should be able to get some more information that way. The GP or a practitioner at the surgery will be able to talk to you, take a history, to ask you some questions about your child and check whether they think that those symptoms are severe enough to worry about needing to examine them. So most of the time, thankfully, we may be able to reassure you over the phone, as we do normally, waiting for the test, as we've talked about with Professor Brown and Dr. Kapasi. Some of the time, though, we might think, as we did before, it would be a good idea to be examined. Now remember that we are working in a different environment now. We're working alongside COVID, so general practice is operating a little bit differently, and so is the hospital. So in a situation where we don't know whether it could be COVID or not, we want to make sure that we're protecting patients and protecting staff. And we have a special place that we bring you to called a hot hub. Which basically means that we have doctors who have the time and you have the right space and you have the right equipment to be able to see you safely. Now that may involve you having to travel a little bit of a distance, so they are situated in different places around Leicester City and in Leicestershire. But it is the safest place for you to go to make sure that we're protecting everybody. And that way we'll be able to make sure that your child is examined safely and and we can make sure that nothing needs to happen. If we're concerned, they're on the phone, we may ask you to go directly to A&E, but usually we'll be able to give you enough.
That's great. Thanks, Dr. Garcia. So
yeah, I should actually add, Dr.
We've got a pathway whereby actually if the child is unwell, they go to you speak to the GP. If the GP feels as if the child needs to be examined, then the child goes to a hot hub. I can see that Dr. Garcia had something else to add, so I'm going to go back to Dr. Garcia.
No, I think I just wanted to remind our patients, our citizens, that you may not see your usual doctor at the hot hub, but the doctor will be able to see your full medical record. So just to reassure them that they won't be a stranger to your child's history if they get seen.
Thanks, Dr. Garcia. I'm just going to run through some of the questions that we have on the chat because I'm really keen on answering the questions of the public. So there was one particular question relating to a person's child, a 13-year-old child who's got asthma, and they're wondering as to whether they should shield or not. I'm just going to answer that question for you. That's dependent upon individual medical advice. So I would seek advice from your GP. There is very clear guidance available from the Royal College of Paediatrics and Child Health as to which children should be shielding and which children should not be shielding. I can see lots of questions relating to schools, and this is exactly why we've got the Principal Education Officer from the Leicester City Council in to talk about schools. So we have Sue Welford who's come in, and she's going to be talking about COVID and in relation to schools. So we're into the second week of school in Leicester, Sue. How are we doing? Are we finding that there are coronavirus cases? And what are schools doing to work with this really challenging situation that we have?
Hello there, thanks everybody, thanks Dr. Kapasi. So we are second week, just finished 2 full weeks of school. Many of you who are parents will know you've been phasing your children back in, so not every child turned up on the 26th of August. And children have been coming in gradually. And all of that's part of the arrangements that schools have put in place. Over the summer, schools have been working hard to set up arrangements to make sure that their school buildings, all the hand washing, the outside space, and all that the staff are well briefed about how to manage in this new situation. So for many schools that will have meant that in terms of organisation, some children now only go down one corridor, others go up a different corridor, children go out through one door into a different door. All primary classrooms, particularly from Key Stage 2 upwards, looking very different, desks facing forwards. So those nice round tables with children speaking across each other all the time, those have all gone. All about trying to make sure that's safe in terms of the environment, making sure the notices are up, that the communal spaces in schools are really well managed. On top of that, there's all the work around how the school is going to actually operate. So the rotas that are put in place to ensure staff have the right place to go. One of the big challenges has been to make sure that staff don't mix with each other when they're not actually in front of the classroom, in front of the children. that they are able to work close with just their nominated group of children, and that's all supported. One of the other challenges has been around lunchtime, so lots of different rotas being put in place, and some schools have had to look at starting some children earlier and finishing some children later in order to allow the flow of children in and out of school. So there's been huge amounts of work gone on to set the schools up right and safe for children's return, as safe as it can possibly be, so that all the head teachers and the leaders can understand where children are, when, and who they're mixing with.
Thank you, Sue. There does look to be a tremendous amount of hard work at the moment to ensure that kids and their families are safe from COVID. And you've listed a whole load of precautions schools are taking to reduce transmission risk. There is a question about social bubbles. What is a social bubble within a school environment, and are different schools setting them up differently?
Yes, they are different because every school building is different. If you look across Leicester City or across Leicestershire or anywhere in the country, each building is different. The staff group is different. The children who are attending are organised slightly differently. So each school has had to look at how to best manage that group of children who may have some interaction with each other. So the starting point for that is for most children to have their class, and that doesn't matter whether they're primary or secondary age. There is the group of children with whom they spend most of their time, and that in a primary school will be with a teacher and maybe with a support assistant as well. For some schools, because of the flow, the toilet arrangements, the playground arrangements, the adjacent nature of classrooms, they've actually had to work that the group of children are working as a year group bubble. So for instance, all the year 5s may have lunch at the same time, go out to play at the same time, even though most of the time they're in a particular group. In a secondary school, they might be grouped in their tutor group for some subjects and then in set groups for other subjects. So that there will be some mixing again there. And for many of the secondary schools, they're therefore looking at a year group bubble. Now, these bubbles are important because it helps the school to track what the interactions have been between different groups of children, so that they are able to identify and understand that if a child or an adult is tested positive, which children may need to be then asked to go and self-isolate. So that's a really clear way of managing that particular organisation for the school on a day-to-day basis.
Thank you, Sue. That's really useful, and it sounds like a lot of hard work has gone into this. Now, I'm just going back to the Q&As, and I can see Bijan has posted some statistics, and so she's got some research from the USA where she's noted that 176 children were killed from flu in comparison to coronavirus, which has been attributed to the deaths of 3 children. I can't verify that statistic, but we do know that very few children are dying from coronavirus. And I suppose one of the sort of graces of coronavirus is that it doesn't tend to cause as severe symptoms in children. And this clearly seems to highlight Professor Lakhani's point about the importance of having the flu vaccination in children. The key thing is, however, is that these children need to stop transmission to prevent coronavirus reaching their family members. And that is where we have the complications. Bijan again has got a really interesting question, and it's about what we're all collectively doing to reassure parents about the safe return to school. So what are we doing to reassure parents and the anxieties that they have relating to coronavirus in school? Because there are lots of anxious parents, understandably so.
Absolutely, there are lots of anxious parents. Over the summer, we in the Leicester City and work with the county as well, with Leicestershire County, to develop some frequently asked questions and some key messages to support parents as they're thinking about that return. So that we can do from a city-wide level. But we also are really clear that the children and the teacher and the parents and the teachers in the school need to have that communication, because as a parent, you know your child's teachers, or you know the school that your child is going to, and if you are anxious, it's that phone call to the head teacher or a senior leader in the school to talk through your anxieties. Schools are more than happy to do that. They've been doing quite a lot of it pre-school, pre the return to school, and for some parents that dialogue is continuing now and may continue over the next month as parents get that level of confidence, or they get that reassurance, or they they find another issue they want to bring out. So that dialogue is really important. And in the city, we are also using our team of education welfare officers, who normally are the people who will be monitoring attendance at schools and having conversations with parents about issues they're facing about getting their children to school. They're going to be doing that now, but they're going to be doing it really in the way of helping those parents understand and have that somebody who's got time to talk to them about their anxieties, who's going to listen properly to what their anxieties are and look at ways that that child might start to come back into school. Because we do really know that the challenges for many children has been the being out of school. One of the great delights we had from head teachers and teachers I've talked to since children have gone back has been the enjoyment that children have had as they've come back into the school and start to be back in that environment, and their desire to want to learn again, their desire to actually, can I do English and maths? Can I do PE? Can I do some science? Because they actually want to be in that environment and learning. And we know that's a really good builder of resilience and good mental health and well-being to be in school. And we know that if you're anxious and you've got real anxieties, it's helping you to manage those anxieties that enables your children to come safely back into school, as safe as it can be. Because that's what our schools are trying to do, is to make it as safe as it can possibly be, so your child can be learning again and enjoying their education and interactions, more socially distanced than before, but we're still with their peers.
Thank you, Sue. So let's just take a case of a 14-year-old child who attends school and they're taking all the precautions that they need to. They come home and they develop a cough and a fever. The parents call the school up and they say, well, my child has these symptoms. What will you do in that circumstance in relation to the year group of that child? What practically happens from that point forth?
Okay, so there's a whole range of things that happen then. The first thing is we would be asking that parent to take that child for a test, because that's a crucial part of this next step. And we actually then await the result of the test. So at this stage, we wouldn't be sending anyone home until we know whether that's a positive test or not. So if the test comes back positive, we actually, the head teacher actually gets in touch with Ivan's team or Public Health England, and then there is a discussion about who that child has been in contact with. The school will have kept a clear log about who those interactions that have been happening, and there will be a detailed conversation and identify who it is who might need to then be asked to self-isolate. It's rather like a super track and trace within a very small space environment, but it's focused on who is it that needs to be self-isolating. Those parents are contacted, children go home, they then are asked to self-isolate for 14 days. And the children who have not had significant contact, they've been in a different class and maybe in the same year group, but in a totally different class, or have no interactions with that child, those children continue to attend school. The children who have been sent home, though, for self-isolation, should also be provided with work. So the idea is that they are given, their remote learning starts to kick in. That's just beginning to get going in the city. So at the moment, the few children who have being asked to self-isolate will be being sent home with some activities, some work to do, the remote learning that everyone got used to doing during the lockdown period.
Thank you, Sue. Thank you, Sue. That's really useful. And I think the key thing here then is that once you have somebody who's got typical symptoms of coronavirus or any other virus for that matter, we need that testing to be done really quickly. And I think if anything, the parents need to notify the authorities as soon as possible to allow that testing to occur quickly. And I'm really hoping that everything can be organised with the powers that be that allow those tests to be done really quite rapidly. I just wanted to say thank you to Professor Lakhani, who is a frontline clinician, and he's just starting a coronavirus shift at 8 o'clock. So thank you very much, Professor Lakhani, for coming, and we look forward to your input in the future. I'm going to come back to Sue and just to sort of look at what other questions we've had from members of the public. And just bear with me whilst I just look through this just for a moment. There we go. So it's practical tips to reduce COVID transmission between children. So of course in the younger age group that's quite difficult to do, but I can see that you've taken steps to try and mitigate that risk. In elder children, how important is it, because children can be really quite high transmitters of coronavirus, even themselves being okay symptomatically, how important is it that teenage children who understand actually comply with the guidelines, Sue?
It's really important, but those of us who've had teenagers and know teenagers well know that that's a challenge. The hugginess and the interactions that particularly not in the formal classroom, but outside the classroom and certainly to and from school is really important. So just to say, obviously in Leicester with our continued arrangements, all our secondary age pupils are expected to wear face coverings in communal areas in schools. So they don't need to wear them in the classrooms when they're all facing the front and learning and having that interaction with their teachers, but they do need to wear them if they're moving around corridors and in communal spaces. We also would encourage children, if they're on to and from school, certainly on the buses, they should be wearing face coverings, but also if they're moving to and from, it is helpful to them. But it's really about reinforcing to those children that actually they are young people, they have responsibilities, and they need to be mindful about what those responsibilities are. And yes, they can have a conversation and they can interact, but do it safely, do it at a distance that's going to be supportive of each other and of their families they're coming back with. And the other absolutely key bit of this is the washing of the hands on entries, as they're leaving, as they're arriving home from school, making sure that they're doing that regularly and keeping themselves and they're safe. The other thing we've made sure that schools are promoting is for those children who are coming back into a home, that if they can, it's really sensible to change clothes. So it's a useful thing. It's particularly if you've got vulnerable adults in that home. If you can get out of your school uniform and put something, put your jeans and your t-shirt on or whatever it is, that actually will also help you not transmit as easily. So and if you're not, obviously if you're coming into a house where there are people who are shielding, then you might want to shower as well. So it's about working with our schools are working with our young people to help them understand their responsibilities as well as the responsibilities with each other.
Thank you, Sue. That's really useful, and it's really reassuring to know that the schools are working immensely hard to try and contain the spread of coronavirus. As parents and our children do have a responsibility also clearly to comply with this guidance. I'm just going to ask the presenters to just think of some take-home messages before we close. And before we do that, I just want to give some other sort of messaging which is really relevant for the population in Leicester. The NHS blood team are looking for people to donate their plasma if they've had coronavirus. So we know that people from South Asian backgrounds are far more likely to have something called plasma, which is something in our blood which has antibodies which could save the lives of people with coronavirus. And we're calling urgently on South Asian people who've had coronavirus to donate now ahead of any potential second wave. You can actually donate at the Blood Donor Centre in Mansion House. And we're going to have a link posted onto the chat as to give you more information as to how to sign up to donate your plasma. The second really important sort of update for patients in Leicester City is that some practices are going to be offering coronavirus antibody tests to patients who work in health and social care. Now, these tests are slightly different to the tests which are offered elsewhere because they can tell you whether you've had coronavirus in the past and may give you an indication as to whether you're protected from it. It's only for health and social care staff. To book this test, call your local practice. They may be offering it. At Willows, we've got a dedicated phone line for this purpose. It's a coronavirus risk assessment hotline for our patients, and you can call using 0116 2411 700. We'll post that number on the chat also. The final piece regarding coronavirus is that there is a scheme whereby we're going to be following up patients who've had coronavirus in the coming weeks. We're going to be doing that by 2 telephone consultations, and that information is vital because it's going to provide research to help understand the longer term implications of having coronavirus. So if you've had a coronavirus test which hasn't been through the normal NHS channels, let's say you've had a coronavirus test privately and it's come back as positive, let your practice know because you can then participate in this follow-up process, which will help provide really valuable research. The final bit is that there have been some work which has been delayed as a result of coronavirus, things like cervical smears, where these aren't being performed during the peak. And please get these booked in at your practices now because we're really keen on getting those sort of done to prevent cases of cervical cancer. So I'm going to move on to a final round of take-home messages from all of our panelists. And I'm going to go to Professor Brown as a take-home message. So Professor Brown, any take-home messages for the people of Leicester today?
Yes, definitely. I'm going to sound like a bit of a stuck record on this one, but what I just want to say is let's not throw our sacrifice away. We've all really worked hard to try and suppress those figures. So the virus is still out there. It's still trying to get across our communities. So do everything you can to suppress it, if not for yourself, for the loved ones that you might inadvertently pass it on to. So, you know, keep going, even though it's tiring and frustrated. Keep going because we were making really good progress and we can do that again.
Yeah, that's great, Professor Brown. And you know, I myself want to go back to the King Power to watch City play. So I can't wait until all of this is actually over. So I'm going to go to Sue Welford next. So Sue, any take-home messages to the people and parents of Leicester and the teenagers of Leicester tonight?
Yes, I think my big one is the behaviours out and about around the outside of schools. So one of the things we're really clear about is that rightly parents are dropping children off, children are arriving at school, being picked up, and social distancing, despite the lovely markers we've put around all our schools, is really being compromised. Keep your distance from all those other parents, keep yourself safe, and do wear a face covering while you're waiting outside for that child to come out through the school gates. That will really help you protect your child, yourself, and your family.
Thank you, Sue. Some really wise words of advice there. Face covering, washing hands, social distancing. I think those three key components are vitally important. And Dr. Garcia, any take-home comments for the people of Leicester this evening?
Hi, Dr. Kapasi. Yes, actually, I think just Professor Lakhani isn't here. I just want to remind you that flus, make sure that you protect yourself by getting your flu vaccination, please. Surgeries are offering appointments. Just bring them up tomorrow. Get your child and yourself sorted out. Just a couple of other things, and that's about maybe it's an opportunistic time for you to think about your own health entering the winter season. And maybe we could think about sort of optimizing whether you're still smoking, so stop smoking. Make sure you're eating well. Think about losing weight. We know weight is a big risk factor for COVID. The surgery can help you access support, even if you're not seeing somebody face to face. And don't forget, the screening is open, and please do engage. Don't forget that cervical screening. Do go and get your smears, please, because we want to make sure that we're all looking after you, not just for COVID, but for everything else as well.
Thank you, Dr. Garcia. So I think we've had a really engaging discussion this evening, and I'd just like to thank all of our panel members for attending this evening. I know from working on the front line that everybody in the city is doing all they can to function as best as they're able to, and I think it just pays to be polite to each other, and I think we really value your patience as patients, okay? And please bear with us whilst we're trying to get local NHS services off the ground once again. These webinars are for you, and they are for the people of Leicester. So if there are any burning questions, if there's a hot topic that you want on a webinar in the future, then if you go to our website, there are some contact details there, and we'd love to actually do a webinar because you've got a great idea on a hot topic. We've got a Willows Health YouTube channel, so you can log into the Willows Health YouTube channel and have a look at all of our webinars and all of our patient educational videos. Do engage with your healthcare professionals, get your flu jabs done. Hopefully we're going to prevent a big second spike that's going to require all of us to do everything we can to prevent one. So thank you very much to you all for joining us this evening, and we look forward to hopefully not seeing you in our GP consultation room, and we wish you all health and peace. Thank you. Bye-bye.